My name is Dr. Kevin McCracken. I'm an orthopedic surgeon specializing in spine with St. Peter's Orthopedics. We have physiatrists, we have pain management specialists, we have people that specialize in the whole body. I always been amazed at orthopedics from a young age. The most challenging field within orthopedics was spine because it was more than just a peripheral joint. I enjoyed using my brain and understanding what was causing a person's discomfort. It wasn't just necessarily a spine or back pain or neck pain. It was more to it. And the ability to understand that, help them with that is what I've always loved doing. And usually there are entities that existed within their spine that now, because they've pushed their bodies at a newer level of function, have become a little bit more symptomatic. In other words, you want to get that individual well, but you want to be thinking about how they're going to be doing 5 years from now, 10 years from now. I tell them, I want this to be the only and the last procedure you'll ever need on that part of your body. And what you're trying to do is least intrusively, but maximally effectively, help that person regain their level of function. Where does that individual want to go? What do they want to do with their life? Understanding the whole picture, especially when you're dealing with the spine, because you can't function without it. The ability to minimally invasively fuse parts of the body for people that have instability can be life-changing improvement. In other words, now they actually have a stable spine, so that this wobbly spine that causes pain and spasm, and their inability to get out of bed or to stand out of a chair or walk or function in any capacity is now gone. That has been the thing that I've devoted my life to, is understanding exactly what's going on, and you cannot be blind to anything else in their body. You have to be understanding of the whole body. You have to understand their psyche and understand the psychology, their fears, their concerns, any anxiety or depression that may go along with it, especially if it's been chronic. Understanding that whole picture is so important in getting that person better. Seeing an individual be happy, regaining their level of function, having a new outlook on their life is priceless.